Hello everyone, welcome to today's class. So this is our third lecture in clinical toxicology. So today we are going to discuss the second principle involved in the management of poisoning, that is evaluation. So in this principle, we are going to evaluate the person in a detail regarding various parameters, including the vital parameters like temperature, pulse, respiratory, blood pressure, and some other parameters we are going to see in this particular topic. So again, this topic is of utmost importance for exam point of view and all. So here our first condition in the evaluation is the evaluation for the temperature. Here we will evaluate the person for the temperature. In temperature, our first condition is the hypothermia. Hypo means reduced, thermia means temperature. So basically some drugs which are responsible for hypothermia are alcohol, benzodiazepines and barbiturates. So we will use the rectal thermometer to accurately measure the temperature, and if temperature is below 94 degree Fahrenheit, then we will term it as a hypothermia condition. If there is a hypothermia, we need to go for the rapid management. The first concept involved in the management of hypothermia is the rewarming. What we will do means we will take a water bath which contains the water at temperature of 115 degree Fahrenheit, and we will keep that person in the water bath. We will dip that person in the water bath up to neck, so that his or her body temperature will slowly rise to the normal. Our normal is 99 degree Fahrenheit or 98.6 degree Fahrenheit, we can say rather. Then our another concept is warm blanket. So nowadays we are getting some electric blanket, or some blanket will have water filled on it. So we will use this warm blanket to increase the temperature, but rapid increase of temperature is again fatal for them. So we will try to improve the drop the temperature gradually, that is around 5 degree Fahrenheit in an hour. Then if the facilities are available, we can go with warm air inhalation by nebulizer or some other devices. And some toxicologists or physicians suggest that if we are going with lavage with the warm water, it is again going to improve the body temperature. So however, the rewarming by water bath and warm blanket are the most commonly used method to correct the hypothermia. Then the mainstay to correct the hypothermia is correcting the underlying cause. So the main condition which are responsible for hypothermia are acidosis and hypoxia. If we will correct them, then it is easy for us to control the temperature. Then contradictory to the hypothermia, there is another condition called hyperthermia. In hyperthermia, the body temperature is generally high, or this condition is known as hyperpyrexia also, where our body temperature will go beyond 102 degree Fahrenheit. So some drugs like cocaine, salicylate and amphetamine will lead to condition like hyperthermia. So in this condition, what we have to do means, if there are thick woolen clothes, we have to remove all the clothes. As a person is feeling cold in the hyperthermia condition, they will insist to wear the clothes. So anyway, we have to educate them and counsel them, and we have to take their clothes. And if there is availability of ice packs, we can use these ice packs in the neck region, in between the shoulder and neck, and in the groin region, in the abdominal cavity and lower limbs joints, that is called groin area. There also we can keep the ice packs so that the body temperature will rapidly come below. Then we can go with the cold immersion. In cold immersion, we have done a hot bath in the hypothermia. Similarly, we will do cold bath in the hyperpyrexia, where we will have water of around 77 degree Fahrenheit, and we will dip the person up to neck so that his body temperature will rapidly get down. Similarly, in this situation, in the hyperthermia situations, normal NSAIDs and paracetamol like antipyretic will not be that much effective. If required, we can go with the dantrolene type of drug. Our third condition in the evaluation is the acid-base imbalance. We have to assess for the serum electrolyte, because the mismatch in electrolyte is the major cause for acidosis. So we have to assess the body pH also. If pH is less than more than 7.4, it is known as metabolic alkalosis. It does not require much attention, and this is very rare condition also. However, the metabolic acidosis is the common condition. which can be determined by measuring the anion gap. Right here we will take one example how to assess this anion gap. We have to add all the positive charge carrying ions in one side, and then we have to subtract all the negative charge carrying ion in the another side. So example, if my sodium level is 138 and potassium level is 5, then the carbonate level is 22 and chloride level is 90, then we have to sum this positive ion value and we have to sum this negative ion value. Then we have to see the gradient between these two and we will obtain one value. Then we have to check this value against the reference. The reference range is around 12 to 16 millimole per liter. Now 16 to 20 is known as buffer area, which does not require any clinical attention. But if the gap is more than 20 mmol per liter, this condition is known as acidosis. And the main cause for this acidosis are hypoxia, that is lack of oxygen in the bloodstream. Similarly, respiratory depression or respiratory failure condition. To manage this, we are having one drug called sodium bicarbonate. So it will help us in bridging the gap of anions. That in another word, it will help in enhancing the systemic pH and help us in correcting the acidosis condition. So how to give this drug? We have to take 2 ml of sodium bicarbonate, that is 8.4% of sodium bicarbonate, and we have to mix it in 1 liter of 5% dextrose, and we have to infuse this solution over 3 to 4 hour period of time. So up to when we have to do that? Up to our normalization of anionic gap. Once anionic gap is normalized, we have to stop it. Right? This is how we have to correct the metabolic acidosis condition. Then our fourth condition is convulsion. So there is a basic difference between convulsion and seizure. Seizure is abnormal electrical activity in our brain system. However, convulsion is the uncontrolled jerky movement of our skeletal muscles. That is an outcome of seizure. So seizure may or may not be associated with the convulsion, but convulsion is a result of seizure. That we have to understand here. Now there are some drugs like CNS stimulants, and sometimes the withdrawal effect of some illicit drugs, abusive drug or psychotropic agents will also lead to the conditions like convulsions. We have to evaluate them also. Then if there are convulsions, we have to go for the O2 supplementation. Then we can give some benzodiazepine drug. So these drugs will act on the benzodiazepine receptors and they will act as a anti-convulsant agent. So benzodiazepine category, diazepam is the safe drug with the large drug safety index. So we can give in a dose of 5 to 10 mg, and we can increase this dose up to 30 mg and at max of 30 mg in a repeated manner. If these convulsions are not controlled, we can repeat in 1 minute. We can repeat it for thrice time up to 30. If it is controlled, well and fine. If it is not controlled, then we will go to the another potent drug called lorazepam. It also belongs to the benzodiazepine category. We can give up to 2 mg. Then in majority, 90 to 95% cases, these drugs will control the convulsion. If it is not possible to control the convulsion by these things, then we are having some another substitutions like phenytoin, midazolam and all. Ultimately, if they are also not working, we will go with the phenobarbital 20 mg per kg. So this drug will definitely control the seizure, right? And the phenobarbital is again recommended for the status epilepticus also, where recurrent seizures are coming again and again within the 5-minute gap of convulsions without the complete resolutions, right? Then another condition is the agitation. So agitation, the same drug like diazepam and lorazepam can be used. So no need to manage this separately. If there is a convulsion also, agitation also, if we are giving any benzodiazepines or phenobarbital, agitation will also be taken care by that particular point. Dosing almost remains same. Then there is another condition called movement disorder. In the movement disorder, no any drug is required. These tranquilizers will take care of this also. Then the another condition is the electrolyte imbalance. So this electrolyte imbalance will lead to some other conditions like metabolic acidosis also. So we need to take care of this. Then in the electrolyte disturbances, our first type of electrolyte disturbances is the hyperkalemia, which means that the potassium level is increased more than 5.5 milliequivalent per liter. So in this situation, these potassium channels are abundantly found in the heart and neuronal region also. Due to that, there is a cardiac arrhythmia conditions, and sometimes it may lead to the seizure conditions also. And this potassium is also linked to the action potential, means our body's information system also get hampered. So we need to take care of it. If it is less than normal range also, this is problem. If this is more than normal range also, this is problem. So if the potassium level is high, we have to cure it by give glucose with insulin, or sometime with sodium bicarbonate and calcium gluconate. Why we are giving this means, when we are giving glucose, this glucose will go inside the cell. When this glucose will go inside the cell, this glucose will carry one ion of potassium also. So we will first give glucose. Due to the glucose, this potassium will bind with the glucose molecule, and the insulin will push this glucose inside the cell. When this glucose will go inside the cell, potassium will also go inside the cell. Then in the bloodstream there is a deficiency of potassium, and we will able to manage the hyperkalemia situation. But if there is extreme hyperkalemia situation, we have to go for the hemodialysis. It will show an excellent result in managing the hyperkalemia. Then another situation we will see, that is hypokalemia. In hypokalemia situation, now potassium levels are low, then we can go with the supplementation of potassium, so which will replace the decreased potassium level. Then similarly hypernatremia, that is level of sodium will go above 150 milliequivalent per liter. In this condition, we will give the loop diuretics. Then these loop diuretics will act on the sodium potassium co-import pump and help us in removing the excess of sodium level, and the sodium level will get normalized. Similarly, if there is lack of sodium in our body or in the patient body, at that time we can go with the sodium salines, which contain these sodium ions, so it will replace the deficient sodium levels. Then another condition is the hypocalcemia level. So in this condition, the calcium level will fall below 4 milliequivalent per liter. So to replace the decreased calcium level, we will go with the drugs like calcium gluconate. That to 10% injection will come in a vial of 10 ml. So we have to inject this calcium gluconate in the slow IV manner, so that the depleted or the decreased calcium will get replaced in the blood circulation. Right now, again to recall, to revise the today's class. First, we have seen the hypothermia condition, where the temperature is less. There are certain measures, rewarming, warm blanket. Then similarly, another condition called hyperthermia. In hyperthermia situation, what we will do, we will try to take down the body temperatures by removing the cloth, by cold water bathing and ice packing. If these things are not working, then we can go with the dantrolene. Then there is a acid-base imbalance. Then acid-base imbalance can be maintained by giving the sodium bicarbonate, which will increase the pH of our systemic circulation and curing the acidosis situation. Fourth is the convulsion. If there is a convulsion, we will go with the calming drug and anticonvulsant drug. Example, benzodiazepines followed by the phenobarbital. And the agitation type of conditions will be taken care by these tranquilizers and anticonvulsant drugs, including the movement disorder. And if there is a electrolyte disturbances, we have to manage this electrolyte level. If there is a high potassium, we have to go glucose with the insulin. If there is a low level, then we have to go for the replacement. Similarly, sodium is high, we have to go with diuretic. Sodium is low, we have to replace it by saline. If there is a low level of calcium, we have to replace it by the calcium gluconate. So this is how we are going to evaluate the situation and manage the situations there only, right? So our second principle was evaluation. In the evaluation, first we are evaluating temperature. Hypotemperature also is there, that is hypothermia, and second is the hyperthermia or hyperpyrexia condition. Then our third condition is acid-base balance. We have to maintain the acid-base conditions in the body. So there should be no alkalosis, no acidosis. Then our another condition is the convulsion condition, where we have to cure the conditions like convulsions. The another condition is the agitation condition. Agitation can be taken care by the tranquilizers that will calm the patient. So generally benzodiazepines, BZDs are the excellent tranquilizers also. Then another is the movement disorder. Not much pharmaceutical intervention is required, but it should be monitored. Then our last parameter in today's class is the electrolyte disturbances. So these electrolyte disturbances need to be corrected by replacing the deficient level of electrolyte or removing the excess level of electrolytes from our blood circulation. So this is how we are going to evaluate the patient and simultaneously manage the condition, abnormal condition during the evaluation. So thank you for listening to today's class. So this is the second principle, that is the evaluation. So note of this evaluation also will be posted in the Telegram group.